before I, there we go, as I introduce you. So tonight we are honored to have Dr. Stephanie Cleland sharing about health impacts of wildfire smoke and extreme heat on women and girls. Dr. Cleland joined the Faculty of Health Sciences at Simon Fraser University in September 2023 as an assistant professor and the Legacy for Airway Health Chair in Promotion of Lung Health. She is also a research scientist at the Legacy for Airway Health at the Vancouver Coastal Health Research Institute. Dr. Cleland's research focuses on evaluating the human health impacts of exposure to climate change influenced environmental hazards using environmental epidemiology, exposure assessments, and health impact assessments. She holds a PhD and MS.Ph. in environmental sciences and engineering from the University of North Carolina at Chapel Hill, and a Bachelor of Science in Computer Science and Community Health from Tufts University. She conducted her dissertation research as an Oak Ridge Institute for Science and Education Research Fellow at the United States Environmental Protection Agency in the Center for Public Health and Environmental Assessment. So welcome, Stephanie, Dr. Cleland, and I'll turn it over to you.
Perfect. Thank you for the introduction. Very, very long-winded. I should make my bio a bit shorter. But us academics love to have a long bio.
That's great.
So can everyone see my screen?
Yes.
Perfect. So I'm going to be talking today about the health impacts of wildfire smoke and extreme heat on women and girls. And I'm fortunate enough to be calling in from the traditional and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh people. And I'm at Simon Fraser University and the Vancouver Coastal Health Research Institute. And what I'm presenting today really is an overview of what I focus on in my day-to-day work. I really care about understanding how climate change impacts our health so we can actually do something to build resiliency in the face of climate change. And I'm happy to kind of run through it and then take questions, or if you'd like to interrupt and ask questions, I'm also happy to do that, whatever works best for people. So for a quick agenda of what I want to talk through today, I'm first going to talk about our increasing exposure to wildfire smoke and extreme heat. And then I'm going to walk through what we currently know about the health impacts of wildfire smoke and extreme heat. And then I'm going to talk about specifically impacts on women and girls. And finally, talk about what we can do to reduce exposure and the associated health impacts. So diving right into it and talking about increasing exposure. So I'm sure, as many of you know, climate change is rapidly changing our environment, right? And this is increasing our exposure to a lot of environmental hazards. And this includes things like flooding, extreme heat, wildfires, extreme weather events like hurricanes, drought, right? It's having a lot of critical impacts on the environment we live in. And one of the key things about climate change is those risks are different in different parts of the world, right? So it's not the same risk in every part of the world. Certain regions have different risks from climate change compared to others. So this map is showing the top climate risks across the globe. And you can see that, depending on where you are, if you're in sub-Saharan Africa, if you're in South America, if you're in North America, right, what the risks are changes. And while there's a ton of climate risks we could talk about, what I'm going to be focusing on again today is heat stress and wildfires. And something I kind of want to point out with heat stress and wildfires, right, you can see clearly the Western US and Western British Columbia is popping off as a big wildfire risk area, as you all are very aware, right? And then heat stress is really happening in a lot of regions over here as well. So you can see a lot of the regions that have heat stress also are very adjacent to regions that have wildfires. And this is because those two things are related hazards. And one of the most known things that I think is indisputable at this point is that climate change is increasing our temperatures, right? 2023, based on available data from NOAA, was the warmest year on record. So this plot here is showing the average baseline temperature, and you can see by how much 2023 exceeded those average baselines, right? So the world is getting a lot hotter, and this is happening across most of the world, right? So you can see how much hotter it was from the baseline in this map. And with a few exceptions of some regions in India and the United States, most places are on average hotter in 2023 than they have been historically. And this increase in temperature is increasing our exposure to extreme heat. So currently it's estimated that about a third of the world's population is exposed to deadly heat events each year. So that's a relatively large number when you think about the global population, and this number is increasing with climate change. So this map to the left here is showing our historical estimates of number of days above a deadly threshold for extreme heat. And this is showing estimates under a future climate change scenario that's high emission. So if we continue to produce a lot of emissions and climate change continues at a relatively increasing rate, right, we're going to see a ton more deadly heat events across the globe. And one key thing when we're thinking about extreme heat exposure, while we know that people across the world are exposed to it, this exposure isn't experienced equally. So what this plot is showing here is showing high income to low income regions and the number of heat wave days they experience and the total person days of exposure. So like how many people are exposed to extreme heat. And what you can see is once you're looking over at low income regions, they have much higher exposure to both heat wave days, and then when you put that at the population level, much higher exposure compared to these higher income countries. And this is especially true in more recent years. So these low income regions are bearing the brunt of this increased exposure under climate change. And now shifting gears, right, another effect of these increasing temperatures is also increasing wildfires, right? So as as temperatures increase across the globe, this is causing snow to melt sooner. So we have lower snowpack. It's drying out our forests. It's drying out the subforest. And what all this means is it makes perfect conditions for more wildfires. And this is increasing how many wildfires start and how much area they burn. So not only are more wildfires happening, they're burning more areas and lasting for longer periods of time. And what this plot to the left is showing is an estimate of, in the Western US, what the number of areas burned by wildfires would have looked like without climate change versus with climate change. And what you can see really clearly here is that we've had a lot more area burned with climate change than we would have without. So it's really increasing the amount of wildfires. And the aspect that I focus on isn't the fires themselves, but is on the air pollution that comes from these fires. So wildfires emit enormous amounts of air pollution. And one of these things that happens with it is it's not just a local impact where the fire is, right? Wildfire smoke travels really long distances. I'm sure all of you have experienced the days in the summer where the sky is hazy, the sun is orange, you can't really go outside without feeling like your throat is burning, right? And you don't have to be living adjacent to a wildfire for that to happen. And this map to the left here is showing from the 2023 Canada wildfires, which were the worst on record in the country, right? How far this smoke traveled, right? So we have this smoke plume moving, and you can see it actually reaches all the way across the ocean with elevating levels even into Europe. So it has this really long range impact on air pollution levels. And when I talk about wildfire smoke, before I get into a bit more, I want to briefly explain what that means. So wildfire smoke isn't just one air pollutant, it's actually a complex mixture of a bunch of different air pollutants. And this includes very small particles and other hazardous gases. And when we talk about it from a public health standpoint, we tend to emphasize these very small particles. And these are what we call PM 2.5, which is these really microscopic particles. This here is a diagram of a human hair, and these little tiny pink ones are how small those fine particles are. And these are the particles that could get inhaled into the deepest part of your lungs. They enter your bloodstream. They can trigger systemic inflammation and then cause a whole host of health issues. So when we focus on wildfire smoke, we often focus on the very tiny particles in wildfire smoke. And similar to heat, we can also see that exposure to wildfire smoke is increasing. So currently it's estimated that each person on average experiences about 10 days of wildfire smoke exposure per year, but that's changed over time. So these maps here are showing the amount of fine particles from wildfire smoke from 2000 to 2009, and then from 2010 to 2019. And while it's kind of hard to tease apart visual differences here, if we look at the map of the trend, anything in the map that's red or purple, right? These are areas where our exposure to wildfire smoke is increasing over time. So you can see there's a lot of regions where there's increased exposure to wildfire smoke. And similar to heat, wildfire smoke exposure is also not experienced equally. So this is looking over time at the average smoke exposure in places with low to high human development indices, which is kind of a way to measure how developed a place is, the life expectancy, the resources, and also showing the differences in exposure by low to high income. And you can see here, compared to all the others, places with low human development indices and places with low income have much higher exposure to wildfire smoke. And this has been consistent over time. So hopefully I've now provided enough evidence that our exposure to heat and smoke is increasing and a lot of people are impacted. And when we think about that, we need to understand what the health impacts of those increasing exposures are. So to provide a quick lay of the land of what we currently know about the health impacts of wildfire smoke and extreme heat, their impacts are actually quite similar. Whether you're exposed to high levels of smoke or high levels of heat, the ways it can impact your body have a lot of overlap, right? So if you're exposed to either smoke or heat, there's a lot of really strong evidence that this really impacts your lungs. So it can exacerbate asthma, right? Lead to more asthma attacks. It can cause respiratory infections. It can increase the likelihood that you're going to be admitted to the hospital for a respiratory complication. Similarly, both heat and smoke have been shown to have a strong impact on our hearts. So it can increase the risk of heart attack. It can increase the risk of exacerbating existing heart conditions. And again, increase the likelihood that you're going to be admitted to the hospital due to some sort of heart complication. And there's also a lot of evidence that both heat and smoke can just in general increase your risk of death, right? So there's strong evidence that when you're exposed to high levels of smoke or high levels of heat, that this increases your risk of death from any cause. And on the more emerging health impact side, so a lot of the research to date has focused on our lungs, our heart, and all-cause mortality. But there is emerging research looking at different outcomes like birth outcomes and our cognitive and our mental health. And what the evidence is showing is that both wildfire smoke and extreme heat can increase the risk of adverse birth outcomes. And this includes things like stillbirth, miscarriages, preterm birth, low birth weight, right? A wide range of adverse birth outcomes. And for things like low birth weight or preterm birth, this can have an effect on the child moving forward in their life, right? So if they're born at a low birth rate, that can impact their lung development. That can impact kind of their healthy trajectory throughout life. And this is because of a health impact that was experienced when someone was exposed during pregnancy. And there's also growing evidence that wildfire smoke and extreme heat can impact our brains. So there's evidence showing that it can impact our cognitive performance and our cognitive abilities. So on the wildfire smoke side, it can increase the risk of dementia. It can also just simply impact our ability to pay attention, right? We're going to be less focused. We're going to have a bit more brain fog, and heat's been shown to have a similar effect. And there's also growing evidence that it has a really negative impact on our mental health. So in terms of anxiety, depression, stress, suicidal thoughts, right? Both exposure to heat and smoke can impact our mental health. And that kind of ties into a larger conversation about the mental health impacts of climate change. But I think it's important to note here how wide-ranging the health impacts of both of these things can be. And to quickly touch on wildfire smoke a bit more, one of the things that wildfire smoke has an impact on that extreme heat has less of an impact on is chronic diseases. So there's growing evidence that exposure to wildfire smoke can not only exacerbate things like asthma, it can also increase the likelihood that you're going to develop asthma. So for example, if a child is exposed to wildfire smoke every summer for the first 5 years of their life, they're more likely to develop asthma at a later age compared to a child who wasn't exposed to all of that smoke. There's also evidence that wildfire smoke may increase the risk of different cancers. So if you're exposed to wildfire smoke over a long period of time, it can increase your risk of lung cancer. It may increase your risk of brain cancer, right? So there's these chronic disease outcomes that we can think about when we're looking at wildfire smoke. And that has a really large implication in terms of health costs and health impacts. And then on the flip side with extreme heat, while chronic disease is less of a concern with extreme heat, kidneys become a very key concern. So wildfire smoke doesn't have a large impact on our kidneys, but extreme heat does. So thinking about the impact that it has on our kidneys due to things like dehydration that's caused by extreme heat is really important. And I know that was kind of a bit of a crash course, but hopefully just provided a general idea of how wide-ranging those health impacts can be. And a lot of the time when we think about the impacts of wildfire smoke and extreme heat, we think about them in vacuums, right? We either talk about exposure to smoke or exposure to heat. But more and more, we need to be thinking about exposure to both heat and smoke. And this is because high temperatures fuel wildfires, and wildfires often occur during the warmest months, right? In the Western US and Western Canada, wildfire season is most often peaked in July through September, and that's also the period that we have the warmest weather, right? So there's a lot of periods in which there's going to be really smoky outside, and it's also going to be really hot. And there's some early evidence showing that when you're exposed to both high levels of temperature and smoke, that's going to actually amplify any health impacts than if you're exposed to just smoke or just heat. And what this diagram to the right here is showing is this is showing the number of the percent change or percent increase in the number of deaths from lung diseases at different combinations of temperatures and air pollution levels. So this bar on the furthest left here, this is the change in the deaths from lung diseases when you're exposed to high temperatures and low air pollution. And this dark purple one on the right is when you're exposed to high temperatures and high air pollution. And you can see that there's more deaths from lung disease when you're exposed to both high temperatures and high air pollution compared to when you're just exposed to high temperatures, right? So this is an important thing when we think about climate change, is not just each of these exposures in a vacuum, but what happens when these exposures are happening at the same time. And one thing I want to emphasize is that these exposures, when we look at it from a very health standpoint, we can say, oh, there's a 2% increase in the risk of blah, blah, blah. But when we actually turn this into numbers, it has a really widespread impact. So looking globally and using information on air pollution data, we can estimate that there's about 340,000 deaths each year that are attributable to wildfire smoke exposure. So wildfire smoke is causing 340,000 deaths each year. And across the globe, this impact isn't experienced equally, right? You can see sub-Saharan Africa has some of the highest number of annual deaths, as does looking over here in Asia. And we still see those impacts in North America and South America, but the distribution of where we see those highest deaths due to wildfire smoke changes. And similarly, when we look at heat, we can estimate that almost 490,000 deaths each year are due to extreme heat exposure. So that impact on health risk is really leading to a widespread impact in terms of deaths. And similar to wildfire smoke, these impacts aren't equal across the globe, right? There's certain regions that are going to have more deaths per year due to heat compared to others, right? We're seeing really strong impacts in Europe, in India here, and then you can see there's these hot spots in certain parts of the US and in South America. But I think one of the biggest things is not just how many different ways wildfire smoke and extreme heat can impact our health, but also who is most at risk, right? Not every person faces the same amount of risk when they're exposed to heat and or smoke. And this is when it's really important to think about who has increased susceptibility. And this includes people like infants and children, right? They're young, they're developing, right? They're going to have more impact because they're intaking more air for their body weight. They have less ability to regulate their temperature, right? So it's going to have a more severe impact on them. Similarly, pregnant people have an increased susceptibility, as do older adults, right? Older adults tend to have slightly weakened immune systems compared to someone who is in their 20s and young and healthy. And so they have increased susceptibility. And this is also true because they tend to have more likely have chronic conditions. And chronic conditions also put you at an increased risk of adverse impacts from smoke and heat. And these chronic conditions can include things like existing heart disease, existing respiratory disease like asthma or COPD, or can include things like diabetes, right? There's a wide range of chronic conditions that can increase your risk. But if someone has a chronic condition, they're likely to be more vulnerable. And when we talk about who's at most risk, we also need to think about not just who has increased susceptibility due to biological factors, but also who experiences really high exposure, right? Not everyone's able to minimize their exposure in the same ways. So thinking about who's going to face the high exposure is really important. And this often includes people who live or work outdoors. So we think about unhoused populations. We think about people who are in living conditions in which they don't have windows and doors they can close, right? We also think about the outdoor workers. This includes things like wildland firefighters, but also agricultural workers, right? They often don't get to come inside when it's hot and smoky, so they have a much higher exposure. And another group of people that's really important to prioritize when we're thinking about health impacts is the people who lack access to indoor spaces with clean and cool air. And I'll touch on this a bit at the end, but one of the top recommendations we make in public health for heat and smoke is, oh, go inside, access clean, cool air. But for a lot of people, this isn't possible due to, resource ability to access resources, due to income, due to the spaces they are comfortable accessing, right? They may not have access to some place that actually has cool and clean air. And to kind of shift gears into women and girls, right? When we think about this, right? When you look at this list of increased susceptibility, this has a lot of overlap with women and girls, right? Pregnant people, children, right? There's a lot of people who have this increased susceptibility who fall under the broad category of women and girls. But this is especially true for women and girls who are living or working in places with high exposure, right? It's when you combine this susceptibility with this very high exposure, you get a really vulnerable population. So now I'm going to quickly kind of walk through an emphasis on, I provided the broad overview of the health impacts, but now I kind of want to drill down into the impact specifically on women and girls. And the slight caveat I'll provide here is in terms of research, right, in the space that I work in, there's not an extensive amount of research specifically focused on women and girls, right, saying exactly what's the impact on this population. But we can look at contextual factors about women and girls to understand what their elevated risk is. And there's a lot of good evidence that women and girls will likely be disproportionately impacted by climate change, including things like wildfire smoke and extreme heat. So thinking about the elevated risk, one of the top things that I'm currently focused on in my work, and one of the things I really care about, is exposure during pregnancy, right? There's a lot of evidence showing that if you're exposed during pregnancy, this can lead to miscarriage, stillbirth, preterm birth, low birth weight, birth defects, right? A really wide range. So thinking about how can we better protect pregnant people while they're exposed to heat and smoke, right? Do we need to start thinking about family planning around different wildfire seasons or heat seasons and try and figure out how to better protect that population? Another thing that's really important is children's vulnerability, right? And this is not different necessarily across boys versus girls, but children as an entire population are really vulnerable to smoke and heat. And this is because they're quicker to dehydrate. As I previously mentioned, they breathe in more air for their body size. So as adults, when we breathe in air per our body weight, we have less air inhaled compared to a child. And that means the child is basically exposed to more air pollution with each breath than an adult is, just based on the ratios. And children often also spend more time outdoors than adults do, and they're still developing. So thinking about that really vulnerable group of people is that, girls really face that increased risk because they're in that very developmental stage. And of the research that has focused specifically on women, there is some evidence that women actually may face a higher risk from the general health impacts of wildfire smoke and extreme heat, right? There's evidence specifically looking at the lungs. So there might be elevated respiratory impacts from wildfire smoke and a higher risk of death from extreme heat. So beyond just people who are pregnant and children being more vulnerable, there's also evidence that there may be certain factors that increase women in general's vulnerability to both smoke and heat. And similarly, some other contextual factors that are really important to consider is, right, when you think about really high exposure to both heat and smoke, we need to think about the ability to reduce exposure. And there was a recent study released that estimated that about 60% more women lack access to cooling compared to men, right? So this plot here is showing the populations at risk of lacking access to cooling, so cool spaces during heat events. And this is divided by rural poor versus urban poor and men and women. And you can see in general, there's higher numbers of women who are at a high risk of lacking access to cooling, right? So the ability to reduce exposure is a gender issue because women are less likely to have access to those resources they need to access a cool space during a heat event. And in general, there's evidence that women may have less access to resources, right? There's some evidence that the poverty rates among women are higher than men, right? About 18% among women compared to about 5.5% among men. And that limited access to resources is going to impact whether people are able to purchase an air conditioner or drive away from an area if it's smoky, or, take the day off their outdoor work job to shelter indoors, right? It really changes our ability to reduce exposure depending on what resources we have. Another key thing is women tend to more often be caretakers, right? So when we think about this in the context of smoke and heat, this is really important because they're not only responsible for their own health and reducing their own exposure, they're often responsible for the health and the exposure of the people they care for, right? So the overall burden of what they need to be paying attention to and who they're caring for changes. And finally, another thing that I really want to emphasize is outdoor workers. I know I mentioned it earlier, but this is a really key population when we think about heat and smoke. And this has been gaining a lot of focus, specifically in the Western US and Western Canada, but also globally. And this is because women comprise about 50% of the agricultural workforce. So it's about half and half. But again, when you think about the combination of factors, right? If someone is pregnant and is an agricultural worker, right, that's those overlapping things that put someone at much higher risk, right? Not only are they really highly exposed, but they're in a vulnerable state due to pregnancy, and that combination of factors can really have a large impact. So now that I've kind of done hopefully not too much doom and gloom, but a little bit doom and gloom of, these exposures really pose a large risk to our health, and they're not getting any better with climate change. I want to briefly touch on what we can actually do to reduce exposure and ideally improve health impacts and reduce health impacts. So the first thing I'm going to talk about is what we can do in the immediate term. So this is kind of putting on my public health hat and talking about, what can we do right now to reduce people's exposure to extreme heat and wildfire smoke? And I think one of the first things and best things we can do is provide clear and accessible communication about the risk factors, about early symptoms of exposure, and about what actions people can take, right? Making sure people know if they're at a higher risk, right? Making sure that people with asthma know they're at a higher risk, or know that people who are pregnant understand that they face a higher risk compared to other people, right? So if people can understand their own personal risk, they're more able to take the appropriate actions to reduce their exposure. And I think it's also really important that people know what the early symptoms of both heat and smoke exposure are and what they need to do in those scenarios. So these tables to the right here is just a screenshot I've taken for some guidance from the British Columbia Center for Disease Control, but they provide a really nice summary of kind of mild to severe symptoms associated with both heat and smoke and what you can do. And generally, if you're experiencing mild or moderate symptoms, that's kind of when the first thing to do is reduce your exposure. So access a cooler space, access a space with cleaner air, kind of take yourself out from the exposure that's causing those issues. And then if you kind of start moving into severe symptoms, that's when it's seeking medical attention as soon as you possibly can, right? But making sure people know that and have that information in an accessible way is really, really important. And I also think another really key thing is ensuring that people know how to check and use their current and forecasted temperatures and air quality, right? So most of us tend to know where to check the weather, right? We check the weather each day. What's the weather outside? How hot is it going to be, right? And I think, making sure people know how to get that information, but also encouraging people to check the air quality like they check the weather. So when you wake up in the morning and check what the temperature is going to be for the day, also check what the air quality is, right? Is it good air quality outside? Is it bad air quality outside? What does that mean for how I'm going to approach my day and go outside, right? And that's a really key thing when we're thinking about trying to reduce people's exposure. And I think knowing both where to check that and how to access that information is really key. And also knowing if they can sign up for local air quality alerts or local extreme heat alerts, right? Depending where in the world you are, this might differ, right? But in North America and US and Canada, there's most places issue air quality alerts and issue, extreme temperature alerts. And that can be a useful way to kind of be like, okay, I really need to change my plan for the day because there's these alerts going on. Another thing I think that's really important in the immediate term to reduce exposure is increasing just general access to cost-effective solutions, right? So when we think about heat and smoke, one of the best ways to increase people's ability to reduce their exposure to either of these things is through things like cooling centers. And cooling centers are basically just a publicly accessible space that has air conditioning and cool air. And clean air shelters is a similar concept where instead of cool air, it's places that have clean air, right? So if it's smoky outside, you know there's a space you can access that's going to have good, clean indoor air, right? And so increasing the accessibility and the presence of cooling centers and clean air shelters in places like libraries or community centers or other spaces that people are familiar with and are used to accessing is really important. And also increasing, things like shade structures, right? Not just increasing access to cooling centers and clean air shelters, but also making sure, can we make the outdoor environment a bit more hospitable during extreme heat events? And that's making public shade structures. I also think something we can think about is providing more subsidies for air conditioning and air cleaners, right? If one of our best recommendations from a public health standpoint is to access cool and clean air during either smoke or heat events, right? Trying to subsidize the cost associated with getting air conditioning and air cleaners for one's home. And finally, I think another really key thing that can be done to reduce exposure is increasing awareness about affordable alternatives for cooler and cleaner air. And one of my favorite things is these DIY air cleaners. And I've included a little screenshot of the instructions for these, but these are relatively straightforward things you can make yourself with a box fan, a filter, some duct tape, and some other tools. So it's relatively low cost. You can do it yourself. And these DIY air cleaners have been shown to be just as effective at reducing the amount of air pollution indoors compared to those really high cost air cleaners. So making sure people know about these affordable alternatives and providing access to the resources to build these, I think, can be a really key way right now to improve people's access, to clean and cool indoor air. And then, a lot of what I just talked about focus kind of on the individual onus and how can we communicate, make sure people know their own risk and can clean their own air. But I also think it's important to think in the long term because that's not a forever solution. And I think in terms of trying to reduce exposure to heat and smoke in the long term, one of the best things we can do is work towards climate justice, right? And if you're not familiar with climate justice, I've included this graph here that kind of talks about the different pillars of climate justice. But this includes things ranging from resilience and adaptation to, environmental justice to climate education, and kind of working towards this as an entirety will likely increase our general resiliency to wildfire smoke and extreme heat. And within that, I think it's really key to make sure we equip governments and communities with the knowledge and resources they need to build resiliency, right? We need kind of communities and governments to be able to build internally their own tools and resources to make sure their communities and countries are resilient to extreme heat and wildfire smoke. And I also think it's really, really key to continue advocating for the rights of people facing the highest exposures and impacts, right? And this includes advocating for the rights of women and girls, including advocating for the rights of, low-income families, unhoused populations, outdoor workers, right? They often have less power and less say in a lot of situations. So making sure we're advocating for their right to access clean and cool spaces during extreme heat events and wildfire smoke events is really key. And with that, I've just talked at you for a very long time, so I'm happy to take any questions and just have a conversation about this. And I've put my email up here as well in case you'd like to email me at any point.
Great. Thank you so much. So you might want to, get out of the screen share so that people can really see you well. And questions, raise your hand, put it in the chat.
I have, yeah, thank you, Connie. Oh, that was really good, by the way, Stephanie. Thank you for that. It was great. I do want to, so I read that the US Forest Service says that most of these wildfires, like 85 to 90%, are caused by humans. And so, I mean, I know that it's not, within your, line of work, but it would be awesome if that was a prevention of some sort or an education within our problem with wildfires is, it's human cause. It's kind of like, I remember talking about it with my husband, and when there was that big litter campaign. Now, I'm going to date myself here. Do you guys remember when there was a commercial and there was a Native American man and he was standing and crying? There was a tear running down. There was all this litter all around. Anyway, you ended up being that person that shouldn't, right? Threw something out your window, everybody's gonna point their finger at you and say, "Everyone, what are you doing?" But we need to have more of that, I think, with the problem with the wildfires. So anyway, thank you for that. And maybe that's something that can be talked about, within prevention.
Yeah, no, I think that's a really good point, right? That, when I say climate change is increasing wildfires, it's increasing them because it's creating the conditions for fires, right? It's not igniting the fires, right? We are the problem, right? We are igniting the fires, but they're spreading further and lasting longer and burning for like more because climate change has created the conditions. So I do think, making sure that there is awareness about, wildfire safety and thinking about burn bans and when people can have campfires, when people can burn, wood stoves and other things, right, to reduce the likelihood that something's going to happen, or thinking about California and holding power companies more accountable, right, with power lines. Because a lot of time it's, it's not, a kid with the firework, it's actually, faulty power lines in the woods. And that can spark some of the biggest wildfires we've had in history.
So go ahead, Marie.
That was great. Thank you, Stephanie. And I like your mentioning advocacy, and that brings me back to, what can Zonta clubs do? We can't stop climate change, but we can educate people. And one of the things, they passed a law in Oregon, I think it went into effect last year, and it was designed to protect agricultural workers in times of high heat. And I don't know if the other states in our region don't have similar laws. That's something that we can collectively advocate for. I don't remember all the terms, but I know they have to provide shade on, more shade, access to shade on high heat days, and some other just protective things for agricultural workers. And that was definitely strengthened last year.
Yeah, no, I think seeing those sorts of changes is exactly what we need, right? Because agricultural workers often are also undocumented immigrants, right? They're usually less powerful groups of people, right? So making sure we can advocate for the fact that they need shade, that they need breaks. I think it was Washington might have just implemented something for agricultural workers and air quality, right? And making sure that they have to provide masks and N95s, right? If they're going to be outdoors. So advocating for that, more broadly, so those people have rights to clean and cool air as much as they can in those circumstances is really key.
And I also liked your mentioning the do-it-yourself air cleaners. I know our club is at a monthly event that it's reaching out to people, and I don't see why we can't have flyers on our table that, especially down Roseburg, they're really hit even harder than some areas by the wildfire and the heat. And so a flyer that tells people how to get your own air cleaner. That's a great idea. So I love that.
The page I screenshotted in the presentation is from like a full like guide, step-by-step guide for how to build your own. So like the resources exist for people to hopefully be able to do an easy step-by-step process to make their own.
Heath.
So I really appreciate the program tonight, Stephanie. It's nice and clear and concise. One of the things that kind of back to the public relations aspect, and I don't know if anybody's done this comparative analysis, but I could imagine, that the climate map that you used that had the different kind of levels of, where the worst climate change are, and those sorts of things. Not climate change, but impact. And I think it would be interesting. I don't know if anybody's done this comparative analysis, but would be to compare, okay, if if I live in this relatively pristine area, because there's a lot of them that are, as you mentioned, that are now impacted by the wildfire smoke. What would that be in comparison to smoking cigarettes? So, for example, okay, if you live in this particular area, and for the average person who lived to be 70 years old, this would be comparable to, smoking a pack of cigarettes a day that's added to your risk. Or any comparative analysis been done with those sorts of things? Another one would be with urban, traditional industrial pollution.
Yeah, so what, at least with the traditional pollution, I think people, so on the smoking a cigarette, and I do think people have made equivalents of, if you're exposed to a day's worth of air quality at this level, that's equivalent to smoking one cigarette, right? I'm less familiar with that research, but I do think people have kind of done the equivalency to say, this is like smoking a couple cigarettes a day, right? And, when you're exposed to a really smoky day, that's probably equivalent to smoking quite a handful of cigarettes, right? Because the air quality gets so severe. And then in terms of comparison to baseline averages, there's actually a really good study recently that was, I think, came out of Stanford that looked at air quality trends in the United States. And right, with the Clean Air Act that was brought in effect, right, we've seen, generally speaking, continually declining levels of air quality, which is good. But we've now seen a reversal in those trends in the Western United States, and that's because of wildfires, right? So we've had this steady decline, but that's started to go back up again because of wildfires. So currently the average exposure to particulates in the air, right, might be lower than it was in the 60s, right? Because we had a ton of industrial pollution, but the ways we're exposed is different, right? Because it's really extreme periods for very short time, and it's on the rise, right? So if we kind of look at the trends, instead of having that consistent downward trend, it's kind of now like a little check mark where it's moving back up, and that's because of wildfire smoke. And I mean, I wouldn't be surprised if we start seeing that trend in the Midwest and the Eastern US, because after last summer, right, after the Canadian wildfires, right, it became wildfire smoke was no longer a Western problem, right? It became a entire country problem.
Thank you.
I was going to ask you, the statistic about 60% more women lack access to cooling. Do you think that's related to like socioeconomic things, looking at that sort of thing, and like single parent families, that sort of thing? Or is there another reason?
I think that would be a large driver of it, is kind of socioeconomic, single parent households. I didn't dive into the exact math of how they got that number, but it might be worth looking into. But my guess would be it's largely driven by the socioeconomic differences in single parent households, right? And who's the primary caretaker, right? Those contribute a lot of things in terms of like general ability to access resources, including things like cooling.
The other thing I wondered is about, when you were talking about educating people and communicating about like risk factors, all of that. I wondered if anybody's done any research. Do you think medical doctors really share this stuff, or,
So, yeah, no, that's actually one of the things I occasionally do is present to physicians and things, because a lot of them aren't trained, right? Their medical training doesn't include environmental health or environmental risks.
Yeah.
Right. And that's not a part of traditional medical training. So more and more I'm seeing it become a supplemental part of medical training. So people who are already trained, full physicians, family doctors, right, can get additional training. And I think there's an appetite for it, especially in the Western US and Western British Columbia, because, right, they see the smoke and they have patients coming in with asthma exacerbations and other conditions. So I think, I do see it happening where more people are seeking out that information, but I do think more needs to be done to make sure it's a part of
Mhm.
our medical care. And I think
Goodness.
there's at least talks of integrating kind of what we broadly call planetary health, right? Kind of as a part of medical education. So trying to redo the medical curriculum to, in the same way you learn about other risks for your health and other things that might put you at higher risk for heart disease or diabetes, right? We also talk about air pollution, we talk about temperature, we talk about those. So it's kind of like the holistic view of how, things can affect your health.
Yeah, that's good. Yeah, I was thinking of kids, pediatricians. Yeah.
Yeah,
Well,
and I mean it's a challenging thing, right? Like the pediatricians need to know that people who, OBGYNs, right? If they're doing family planning and thinking about medical care for people who are pregnant or getting pregnant, right? They also really need to understand the risks. And then on the
Yep.
flip side, like do our care, do daycares understand the risks? Do elementary
It's
schools
true.
know when to have recess outside versus inside, right? Kind of it's this whole spectrum of we receive care and information from so many different places, especially, when we're either, if we're in an assisted living facility or if we're in a daycare, right? We're really putting ourselves in the hands of the people who run those spaces and making sure those people also can make informed decisions for the people in their care is really key.
Yeah, it's great. Excellent job. Thank you. Any other questions that or just thoughts that you may have that the presentation kind of stirred up for you?
Stephanie, I wonder if our researchers, even within community health, but in other disciplines as well, beginning to seems like that you have some choices about, do I put my primary efforts in trying to reduce the effects of global warming and climate change, or do I now need to focus more on personal health care strategies to actually be able to treat people, and I just wonder if there's much discussion about those two options.
Yeah, no, I think that's a fantastic question. And there definitely is, I think currently I would say we're at a bit of a shifting point, and at least because most of I do heat, but the vast majority of my work is in wildfire smoke. And there's a kind of shifting conversation of do we know enough now about how it affects our health that we can shift from describing the ways in which it impacts our health to what do we actually do about it. And I think seeing, funding agencies and grant priorities and those things, you kind of can see that there's a shifting current towards community engaged work and making sure you're doing, what we call knowledge mobilization, which is basically, can you actually translate your research into action and into practice and into policy? So I think there is that shift happening. For a long time, it was wildfire smoke was a new unknown, right? But now it's no longer a new unknown. We know a lot about it. So kind of shifting away from the more traditional health studies of, okay, like what's the association between smoke and respiratory disease? And it's like, we know that now. So how do we increase access to DIY air cleaners? What sort of community-based initiatives help increase resiliency? Right. And I do think there is a shift towards those conversations. I think it'll be slow because academia and research moves very slowly. But I am starting to see from when I started in wildfire smoke 6 or 7 years ago to now, right? There's more of a shift on that really focused community engaged research.
So do you see any examples of, particularly in the States, what would come to mind would be interdisciplinary activities between community health and extension in land grant universities, for example?
Extension, what was that? Extension and land grant universities?
Yeah, so all of the land grant universities have large extension outreach programs, and to bring research out to communities. And I'm wondering if you've seen anything where the community health professionals are interacting with those sorts of folks
Yeah, I don't know. So that's a good question. I don't know if the specifically through like the land grant universities, but I do in the States there has been a lot of interdisciplinary community engaged work from things like, you know, community-based like citizen science, right? Air quality monitoring, kind of equipping communities with local air quality monitors so they can understand and look at their local air quality, to kind of things with how do we, do the DIY air cleaners work and how do people use them? And are they actually, we know they're scientifically effective, but if someone brings it into their home, how are they actually going to use it? Does it work in their day-to-day life? Right. So there is kind of that effort to have more feet on the ground with communities. And I think integrating with those, impacted communities is a really key part of the research, because we can't just sit behind our laptops all the time and tell you how bad it is for your health.
Thank you.
That's awesome. Well, our hour is almost up. That went really fast. Thank you so much. We really appreciate it. I wish there were a few more people here, but I'll promote the video when your mom puts it on YouTube. We'll make sure that people are encouraged to watch, because sometimes they can get the information that way too. So I thank you so much. We appreciate it.
Yeah, no, thanks for having me. It was great to chat with you. And again, if you start thinking about advocating for clean air spaces or masks or cooling spaces, I'm happy to be a resource if that's useful.
That's great. That's great. So the only
I
other
have one
thing,
other comment.
yeah, go
I just
ahead.
want to mention to Stephanie. So Stephanie, in 2026, Zonta International will be hosting their international convention in Vancouver. So you should be kind of practicing up on some of those sorts of presentation skills, because you'd be a great example of the kind of knowledge that people, we have people from all over the world that come to that. So
It's true. I was thinking of that.
Your mom's probably already mentioned it, but
Yeah.
She actually hasn't, surprisingly.
Yes, I was going to suggest that to I think it's Lorraine Markham from Victoria, that she consider you and maybe some of your colleagues, if not be a main presentation, could be a panel. I mean, you got all this rich education resources right there.
I will toot British Columbia's horn in that we have a lot of brilliant researchers working on climate change and health.
That's great.
So if there's an appetite for it, I'd happily chat about it.
Excellent. That's great. All right. So I just want to remind all of you on the call that next month we're going to take the month off. So the next time we will meet is in August, and Marianne is going to actually moderate and there's going to be another guest presenter, correct, Marianne?
Well, a guest speaker, but yeah, we'll be doing it. We'll be co-presenting, and you know what? Let people know, because when people like Stephanie and we have speakers on, it's really it's very respectful if we can get enough people out, because it's because I know it's a lot of work sometimes to put together a presentation. So I hope to see a lot of people there.
Right.
All right.
All right. Well, with that, we'll sign off. But again, thank you. Thank you all for being here.
bye-bye.
Thank you. Good night.
Good night,
everyone.